minimally invasive procedures that I do is using a Wolf endoscopic discectomy technique. What the Wolf endoscopic approach is actually doing a discectomy, foraminotomy, or actually rhizotomies through a arthroscope, which actually has a working channel in it, so I can do a lot of work through a 7 or 8 millimeter incision that normally I would do through a large open incision or minimally invasive incision. Just a kind of a little bit review of what anatomy we're trying to work around here. Here's just a spine model, and I'll kind of show you the relationship of some of the anatomic structures. One is the disc here, the nerve root here, the facet joint here, and this is looking at you kind of obliquely at the side. And then you've got your vertebral bodies, spinous processes, and in somebody that has a herniated disc, typically what you're doing is going in, if there's a herniated disc at the L4-5 level here, you're making an open incision about like this or even longer depending on the size of the patient, and going down the center of the spine, stripping the muscles off of the spine on both sides, or one side if it's unilateral, and doing your surgery through an open incision using retractors. So I've essentially disrupted the soft tissue all the way down to where I need to work. Using an endoscopic approach, there's a number of different approaches that can be used. Your standard approach developed by Dr. Cambon and Dr. Anthony Young, and Dr. Anthony Young is actually one of the physicians that I trained under, is going through a posterior lateral approach for disc herniations, for stenosis, tightness around the nerves, and also a posterior lateral approach for treating facet pain. And essentially this technique utilizes placing a patient prone or on their belly and giving them some numbing medicine around the area that you're going to work, and giving them a little bit of what I call happy juice or sedation. And we go in through just a tiny incision, and when I'm talking tiny, I'm talking 8 millimeters, so about a 1/4 of an inch incision to do this surgery. If the disc is herniated at this level, we're essentially making a small stab incision up here under X-ray visualization, coming in between what's called Cambon's triangle, and inserting a wire followed by this little dilator right into the disc. After placing that dilator in, we place this is just a working cannula that goes down over this dilator, down to the spine. We tap that dilator as well as the working channel into the disc itself. We've actually dyed the disc with a dye called indigo carmine so that we can tell what is disc material and what is annulus, which is the outer part of the disc. The disc material dyes blue, and the outer annulus typically stays more white. We take out the inner dilator and actually use an arthroscope, and this is a specific scope, and you probably can't see this, but it actually has a 3.5 to 4 millimeter working channel down the center of it. We put this down into the spine, into that disc, and I actually have a viewing window here that I can look up at the nerve root here. I can go into the disc and work into the disc from inside the disc out, but I can also see the bony structures that cause tightness around the nerves, including a disc herniation itself. I can direct this steeper into the disc, or I can actually drop my hand a little bit and go after free fragments in the epidural space if there are any little fragments of disc within the epidural space itself. Through this little working cannula, I can place little biters, which are similar to what we use in open procedures, but just longer and a little bit smaller, and I can take out disc material. I can take out what's called ligamentum flavum, and anything that's pushing in on the spine. And more recently, they have developed little shavers that I can actually put these shavers down these cannulas with visualization and actually shave the undersurface of the bone here. So I'm freeing up bone from around that nerve through this tiny little incision just by dropping my hand and coming underneath the spurs. So I can do that through this posterior lateral approach. More recently, in using a more standard approach, I've been to Germany and worked with Dr. Rutten on what is called a interlaminar approach for treating herniated discs, which is very similar to doing an open approach, only you're doing it through that small of a tube. And you're going into either the 4-5 or 5-1 level, shaving off a little bit of the bone along the sides of the spine here, putting your cannula in, similar to what you did with a posterior lateral approach, where I'm just using this to kind of free up the tissue down to a pretty stout ligament called the ligamentum flavum. I dock that cannula, or the dilator, on that ligamentum flavum, and then once again pass my working channel, take that out, put my scope in. After the scope is inserted, I'm actually able to bite out some of that ligamentum until I get down to a visualized nerve root and dura where the nerves are coming out of. From that, I'm able to work this cannula down into the disc space, and I'm actually able to, through this 8mm portal, grasp any disc material in the disc space and take it out. And this is a more midline approach to a disc herniation. As well as the midline approach, also worked on, similar to the posterior lateral approach, a more straight lateral approach to accessing the disc and epidural space. So you can see with this technique, it's very similar to doing any type of arthroscopic procedure, only we've taken it from a open approach into a very, very minimally invasive endoscopic approach.